So I got a couple questions asking me, how do I run a medical billing business and work a 9-to-5 job? And these are legitimate questions because I would probably wonder that myself if I haven't been doing it for several years. So I'm going to explain to you what you can do as a medical billing business owner while working full time. So keep watching. Now, I thought I'd break it down into like 3 sections, I guess. One would be the main duties that you have, or the basic duties. The next ones would be the add-on duties that you can also offer. And then there are like tips and, other things that you should consider. I also wanted to say first that everybody's medical billing business is different. So what I'm telling you is my experience and what I do as a medical billing business owner. So you may do things completely different. If you're not working a 9-to-5 job, then you will have more time to do certain things. This is specifically speaking about working a full-time job and running a medical billing business. So let's start off with what I do as a medical biller. I submit claims, I post payments, mainly insurance payments, and then we have the AR management, meaning denials, follow-ups on claims, rejections, all of those things. So those are like the 3 basics of medical billing. And I did do a video before talking about the levels, I guess, or packages that you can offer in your medical billing business. And those 3 were basically like in that first level. So if you're just starting out, you just started your medical billing business, I would always recommend that you start small. You don't have to offer everything in the world. Even if you know how to do credentialing and, consulting and coding and eligibility, like even if you know how to do all of those things, you don't have to offer all of those things at the beginning. You can kind of see how it goes, how you can, handle it, especially if you're working a full-time job. So to answer their question of how do you do these things during your 9-to-5 job, you do not need to do some of these things, or most of these things you do not need to do while it's within that 9-to-5 time or that full-time, time. You can submit claims whenever you want. I am a morning person. I know I've told you guys that several times. So I would submit claims in the morning. If I get up at 5 o'clock and decide this is a time that I'm going to do it, I will do it then. You don't have to submit claims at a specific time or between this, certain hour of the day. Then posting payments. Again, that doesn't have to be at any specific time either. Whether that's manually or that is, automatically, you can do that anytime. When it comes to patient payments, now the patients for the clients that I work for, they do not call me. They do not call me and make payments. They do not send their payments to my P.O. box. They send all of that to the provider. So the provider pretty much deals with all of that. So as long as the provider is there during that time, then they can take the payment. So that's not a problem for me, at least. Now, if for your medical billing business, you decide that you're going to be the one to take payments, then of course, you're going to have to be there to take payments. You're going to have that system attached to yours or however it goes to take that payment. But I know that I couldn't do that, so that's not something that I offer. Now, when it comes to the AR management, which is like the denials, the rejections, the claims follow-up, you can do that at different times of the day. So you can do it before work. Now, I know in my area, I think Medicare opens at 8 o'clock or even 7:30 if I'm not mistaken. So if I needed to call them before work, I would do that. When it comes to during lunch, I would also do that. If I need to call one of the insurance companies that, let's say I didn't get to do it in the morning, I would call them in my lunchtime or after work. Now, you have to know the times of these insurance companies, when they open, when they close. And fortunately, a lot of these insurance companies have nice long hours. So they might open at 7, but they might close at 8. I think AARP, they're like open on Saturdays. So there are different payers that open up different times. Now, if there is one that is in between your time that you work, like I said, do it during your lunch. You have to know what you need to call about, have all your information there, be prepared so that you can answer all of the questions, get it done. It's just a planning thing that you need to do. It will take a little bit more work than it would if, of course, that's your full-time job and that's what you're doing, because now you have to plan around certain times to do it, but you definitely can get it done. So basically, you can have a medical billing business, run a medical billing business, and do the things that you have to do. You just have to plan very well. Now, there are some add-on services that you can actually offer, that some of them I offer, some of them I don't, and you don't have to offer all of them. You don't even have to offer the ones that I talked about. Again, this is your medical billing business and you offer what you want to, but some of the clients might ask you to do eligibility and verification. They might ask you to do pre-authorizations. They might ask you to do coding, credentialing, contracting. These are all add-on services that you can add on eventually. And I say eventually because, again, you need to figure out how you're going to do the basic billing services before you add on all these other things. Now, when it comes to eligibility and verification and pre-authorization, I personally don't offer those. And I don't offer those because I know I work a full-time job. And because I know that when a provider needs a pre-authorization or when they need for a patient to get checked and they need eligibility checked, sometimes it can be now for now. And I also don't offer it because I don't really like to do it. Where I've mainly worked, I know how to do it, but where I've mainly worked, the front desk has always done that. And I always suggest to my clients that the front desk do it because they can do it and I believe that they should do it. I think that a medical biller's job really and truly starts at submitting claims. Now, that is my opinion, and that can be a thing. So let me know what you believe when it comes to medical billing. Do you think it starts at eligibility and verification, or do you think it starts at claim submission? But I personally think that it starts at claim submission. So I don't offer these other services. But if you do decide to offer these other services, you need to make sure that you'll be able to handle them. Or you need to let the provider know that you can't do the eligibility maybe now for now. You would have to maybe do it, a week before or a few days before. Or when it comes to pre-authorizations, the same thing. You're going to have to do it before and not now for now. But I don't want to hold up a provider's, being able to see a patient or a patient going in to be seen because they're waiting for me to do these services. When it comes to credentialing, now I do that, but that was something that I added on a little bit after I started to do it. And that's because I knew how to do it. And it's not something that's done all the time, every day. And it's something basically that you just kind of following up on. So I can follow up on someone's, getting contracted with a certain insurance payer. Just the same way if I had to call an insurance company to check on a claim, I can do that. So I actually do credentialing, and that's an add-on service that I have. Coding now is also something that you can add on. I don't offer coding services, but if you decide that you want to do that, that is something that you don't have to do now for now. Now, again, all of these things are dependent upon the client and what you and the client agree upon. So if you have a client who says that, they want you to code the same day that they do the service, that may be an issue. So you can't agree to something that you're not going to be able to handle. You need to let them know, if I'm doing coding, then, the coding might take a day or two or a week or whatever you and them decide. So make sure that you don't just agree upon services and you're not able to do them because now the provider is expecting something and you're doing something else. And remember that if you ever need to speak to anybody about starting your medical billing business, your maybe have questions, you're fearful, you want to know what it's like, then make sure you schedule your remote one-on-one with me. We can talk all about it. It's a 45-minute session and you can get all of your questions answered. Now, here are some things to think about. You need to think about how you're going to communicate with the staff, with the provider, and we already talked about the insurance company. So the insurance companies, like I said, you can call them throughout the day. They have good times and long times sometimes. So it's not just, 9 to 5 or 8 to 4 or whatever it is. And if it is that, then you can call them during your lunch if you have one, hopefully. As far as communicating with the provider and the staff, the same thing goes for them. I have providers who call me and I'm at work, but they know when I sign them up that sometimes they may not get me because I am not an employee, which is the second thing you need to remember, that you're not an employee. So they may not get you now for now, but you need to make sure that you call them back as soon as you can and you set boundaries. So if a provider calls you and let's say they call you at 1 o'clock but your lunch is at 2, then, they leave a message and then you call them back when you can. Or your policy may be that I'll get back to you in 24 hours. Then make sure you get back to them in 24 hours, or I'll get back to you by email, or whatever your policy is, then you and that provider will need to follow that policy. So it can be done, but you just have to make sure that things are structured and that both of you know what the policy is. And we talked a little bit about you not being an employee, but that is you shifting your mindset. So you can't think like an employee. You have to start thinking like a business owner, and you have to start setting boundaries and setting structure and making this business run the way you want it to run. So you want to make sure that your provider agrees or the client agrees with what your policies are, but you set those policies and they either agree or don't agree. So these are some things that you just need to keep in mind. And last but not least, it depends on the size of the practice. Don't go out there and get a huge practice that's, having 10, 15, 20 providers. Start off small, a 1 provider practice, 2 provider practice, and see how you can handle it along with your full-time job. It is doable. I've been doing it. So if you have any more questions about that, leave that below, and I'll see you in my next one.